Welcome to the Eye Experts. I'm Dr. Eli Sluch, and today we're going to be talking about my favorite topic, dry eyes. What is dry eye? Dry eye, or ocular surface dysfunction, is an umbrella term for your tears not working very well. Imagine you're at the lake and the weather is very good. There's no wind, you look down, you can see the fish, the rocks, everything is very clear. Now imagine the wind picks up. You start seeing ripples, you can't see the bottom anymore, the lake becomes all turbulent, doesn't feel very good. That's kind of what dry eye does, and that's what happens to your tear film.
The eye needs a healthy tear film to feel comfortable and see well. The tears are made from 3 layers: the oil layer, the water layer, and the mucus layer. Each layer is crucial to making a healthy tear film. The lipid layer helps tears from evaporating quickly, the water layer lubricates the eye, and the mucus layer helps mix the two together. Symptoms occur when there is an imbalance between the 3 components, and different dry eye treatment options try different things to restore that balance.
Patients always ask me, why do I have dry eye? First of all, most people do, and second of all, there's many causes.
Age. The body becomes more dry as we get older. Eye irritation from pollen and allergens, as well as exposure to circulating air or eye drop preservatives. Decreased blinking if you're reading or working on the computer or watching TV. Previous eye surgery like LASIK or cataract surgery. Autoimmune diseases such as Sjogren's or rheumatoid arthritis can decrease tear production. Rosacea, which causes skin inflammation as well as the skin of the eyelid. Blepharitis, that's when you form crusties on your eyelashes, which can become infected and cause inflammation. Meibomian gland dysfunction, that's when the eyelid oil glands are not working. And incomplete eyelid closure during sleep or during daytime.
The fascinating thing about dry eye is that it can cause different symptoms in different people, and then those symptoms can be very disproportionate to the clinical findings.
The symptoms include blurry vision, eye strain, eye pain or pain behind the eye redness, eye pressure sensation, gritty eyes, itchy eyes, watery eyes in a reflex response to the irritation, as well as nighttime glare.
Dry eye without symptoms does not require treatment. However, if symptoms do persist, there's many treatment options available. It is important to remember that dry eye is a chronic condition. We usually can't make it go away, but we usually can make it better. We're now going to go over the many treatment options available for dry eye. I will give you my opinion, and I have no commercial interests or relationships to any of the products.
The first and most important option is the artificial tears. Artificial tears are lubricating eye drops that try to mimic your natural tears to help improve symptoms by adding more moisture. They can be used up to 5 times a day. The preservatives in the drops can cause toxicity if used too frequently. Popular brands include Refresh, Sustain, Blink, TheraTears, Retain, and Soothe. Even the Equate drops are perfectly fine. They're all basically salt water in a bottle. I frequently recommend people place the artificial tears near their TV, where they're reading, or by their computer, if that's when they experience the most symptoms. If you want to use drops more frequently, drops that come in individual vials and are labeled preservative-free can be used every 1 to 2 hours. It is important to not use the drops more than every hour or so to avoid washing out the normal growth factors that form on the eye surface. If you feel the drops help but don't last very long, you may try eye drops that come in a gel composition. The gel's a little thicker and blurs the vision for a few seconds. However, the gel stays wet longer and prolongs the lubricating effect of the eye drops. Those are my favorite. The gel drops also come in a preservative-free preparation like Refresh Soluvisc. If you like natural stuff, Similasan makes herbal eye drops, which are perfectly safe and are good at lubricating as well. Certain people do not fully close their eyes at night or are still awake with irritated eyes. Placing a small amount of moisturizing ointment in the eye right before going to sleep will lubricate the eyes overnight and help retain moisture. There are 2 types of nighttime ointments: a thick gel or a Vaseline-based ointment. The gel is a little bit easier to put in the eye, but may dry up by the morning. The ointment lasts longer, but may be a little bit harder to place in the eye. Popular thick gel drops are Gentil Gel Severe, Sustain Nighttime Gel, TheraTears Nighttime Liquid Gel, and Refresh Soluvisc. Popular nighttime ointments are Soothe PM, Sustain Nighttime PM, Gentil Severe Ointment, and Retain PM. The Retain PM ointment contains more mineral oil compared to the other ones. Warm compresses can help melt the oils naturally made in the eyelids to help improve flow and tear quality. Warm compresses are usually done 1 to 2 times a day, but can be done more frequently. A damp towel or a dry eye mask is heated hot but not burning hot, and then placed over closed eyes for 3 to 4 minutes. The mask is then removed, and it's important to forcefully blink 15 times or massage the eyelids to help the liquefied oil to flow out. I usually like to take a plastic bottle, fill that up with hot water, and then wrap a towel around it. It stays hot much longer. Examples of dry eye masks are Thermal On, Ryan Fire and Ice Mask, Microbeads, Compress, or the Brooder Mask. Blepharitis is the buildup of old skin and mucous debris on the eyelashes, which results in bacterial buildup and inflammation. This causes eye irritation and exacerbation of dry eye symptoms. There are several ways to help remove the debris. The eyelashes are first wet with warm water to help soften the debris for about 20-30 seconds. This can usually be easiest done in the shower. Then the eyelashes are washed with Johnson & Johnson baby shampoo because it doesn't burn your eyes. Eyelid scrub wipes can also be used instead of baby shampoo. Popular brands include OcuSoft eyelid scrubs, Clearadex eyelid scrubs that have tea tree oil, Gentle Formula Tea Tree facial cleanser, and OcuSoft Hypochlor. Consuming healthy oils such as fish oil or omega-3 capsules may improve dry eye symptoms. A recent dry eye study comparing omega-3 with olive oil showed improvement in symptoms with no difference between the two supplements. Therefore, switching to olive oil for cooking and salads could be done instead of taking extra supplements. Some people also find the Hydro Eye supplement helpful. The eyes can develop allergy symptoms much like the nose. The symptoms usually trigger itching and irritation. The most effective treatment is avoidance of the allergy trigger, such as new pets or new plants. Otherwise, over-the-counter allergy drops like Zatador or Aloe or Pataday can be used twice a day as needed. Prescription allergy drops which are more potent, like Blepharitis, are also available. Occasionally, steroid drops can be used to treat allergies, but they tend to have a little bit more side effects if used in the long term. It is important to avoid tears with red eye relief. Red eye relief drops constrict blood vessels on the surface and can cause rebound irritation. They're okay to use once in a while, but not every day. You want to watch out for the tetrahydrozoline ingredient. Lumify is a new over-the-counter eye drop which provides a more healthy option for red eye relief. The medicine constricts blood vessels but with a much smaller chance of causing ischemia and rebound irritation afterwards. The tears are produced by the eye tear glands and then drain into the nose as they pass over the eye surface through 2 tear ducts located in the inner upper and lower eyelids. The tear duct openings can be plugged to keep more tears in the eye surface. The plugs are equivalent to a tiny wine cork. Dissolvable plugs can be placed which last for 3 to 6 months. Permanent plugs can be placed which may be removed later but may fall out on their own from rubbing the eyelid. Tear ducts can also be permanently closed in the office of a quick 1-minute procedure after demonstrating symptom improvement with removable or dissolvable plugs. There are 3 eye drops currently FDA approved to help dry eye symptoms: Restasis, Xiidra, and Cequa. The medications help decrease the inflammation in the eye surface in an attempt to increase tear production. The drops are used twice a day to improve symptoms. Common side effects include burning on installation and bad taste once they go down the throat. Occasionally, a short course of eye drop steroids can be used, but carries a high side effect profile. Imprimis makes Clarity C drops, which is a generic version of Restasis. The macrolide class of antibiotics, like doxycycline and azithromycin, is thought to be absorbed by eyelid oil glands and decrease inflammation, thus improving dry eye symptoms. The antibiotics can be taken daily for several months to help improve symptoms, especially in patients who have rosacea. They have a tendency to make skin more prone to sunburn and may cause heartburn and stomach irritation. Azithromycin is also available as an eye drop, but much better side effect profile.
Serum tears are the most natural way to replace your tear deficiency because it mimics the body's own tear production. A phlebotomist will come to your house and draw your blood. A pharmacist will then use that blood to make a concentrated mixture of your natural hormones and growth factors and ship them in little vials that will go in the freezer. These new drops are then placed in the eye to help restore the surface and improve symptoms. This treatment is not covered by insurance and usually costs around $200 for a 2-month supply. In very severe dry eye, where there is severe exposure or decreased nerve sensitivity, an amniotic membrane can be used on the eye. It is a special biological tissue with regenerative qualities. This will rest on the eye and dissolve over a 1-week period. This may allow the eye surface to heal and help improve symptoms. If the surface continues to remain very poor, special contact lenses can be used. Normally, contact lenses are not very good for dry eyes, but there are special scleral contact lenses which form a water reservoir around the front of the eye. It becomes like a little spacesuit for the eye. If the eye is able to tolerate it, the lens may provide long-lasting relief and improve vision.
This has been a lot of information, and if you have any questions about dry eye or are experiencing dry eye symptoms, please schedule an appointment with an eye provider.